Hi there. You walk into a diabetic patient's home and the blood sugar is elevated. The patient admits that they've been just eating everything that they want. And now you're wondering, what should I document to show medical necessity? Instead of guessing, use this simple framework: condition, risk, skilled action, the response, and then the continued need. So let's walk through a real diabetic patient example. Imagine your patient has type 2 diabetes. Today's blood glucose is 286. The patient admits they've missed several medication doses this week, and they also report increased thirst and fatigue. Most nurses stop here. They document the findings and move on. But Medicare isn't paying for you to collect data. They're paying for your skilled nursing judgment. So step number 1 is the condition. Ask yourself this: what is the most important clinical issue today? In this case, the blood glucose level of 286, medication non-compliance, and systems of hyperglycemia. That's today's condition. So step number 2 is the risk. Now ask, what bad outcome could happen? This is where medical necessity starts becoming very clear. The patient is at risk for poor diabetic control, infection, delayed wound healing, possible emergency room visit, or a hospitalization. Suddenly, this isn't just a high blood glucose level. It's a patient with significant health risks. So step number 3 is skilled action. Why was a nurse needed for today? Well, a family member can read a glucose meter. A nurse, they can assess symptoms, evaluate medical compliance, identify contributing factors, and teach disease management, and determine when a physician notification is needed. That's skilled nursing. Today's skilled action might include diabetic assessment performed, medication regime reviewed, education provided regarding medication adherence, diet and carbohydrate intake review, and signs and symptoms of hyperglycemia discussed, and patient notified if needed. The step number 4 is the response. Ask yourself, what happened because of your intervention? Maybe the patient states, well, I didn't realize missing my medication could cause these symptoms. Maybe the patient correctly teaches back when to check blood glucose level and when to call the doctor. Or maybe they still require reinforcement. Either way, document it. This shows whether learning occurred. And then step number 5, continued need. Why are future nursing visits still necessary? Well, this patient continues to demonstrate elevated high blood glucose levels, knowledge deficits, medication management challenges, and risk for diabetic complications. That supports ongoing skilled nursing services. So, putting it all together, here's how the clinical story comes together. Patient noted with blood glucose of 286 during the visit, reports missed diabetic medication doses and increased thirst and fatigue, skilled diabetic assessment performed, medication regime reviewed, and patient educated on regarding medication adherence, blood glucose monitoring, dietary management, and signs and symptoms requiring physician notification. Patient verbalized patient understanding, but continues to require reinforcement regarding diabetic self-management. Continued skilled nursing required due to uncontrolled blood glucose levels, ongoing knowledge deficits, and risks for diabetic complications and possible rehospitalizations. So in closing, the next time you visit a diabetic patient, don't ask, what should I chart? But rather ask yourself, what's the condition? What's the risk? Why was a nurse needed? What skilled action occurred? And why are future visits still necessary? When you think this way, documentation becomes easier. Your notes tell a stronger clinical story, and you naturally support Medicare's expectations for skilled nursing services. Well, I hope this has been a benefit for you today. Consider subscribing, and I hope you have a wonderful day.